The main factor contributing to disability worldwide is depression. Nearly 10% of adults in the United States experience depression. It can, however, be far more difficult to comprehend than, example, excessive cholesterol, because it is a mental condition. The distinction between experiencing depression and simply feeling depressed is one of the biggest sources of confusion. Almost everyone experiences depression occasionally. Sadness can be induced by a variety of events, including receiving a poor grade, quitting your job, getting into a fight, and even a cloudy day. Sometimes there is absolutely no trigger. It just appears out of nowhere. Then, as circumstances alter, those depressing emotions vanish. Different is clinical depression. It's a medical condition, so trying to make it go away won't make it go away. It lasts for at least 2 weeks straight and seriously impairs a person's capacity for either work, play, or romantic relationships. There are many different symptoms of depression, including low mood, loss of interest in activities you once enjoyed, changes in appetite, feelings of worthlessness or excessive guilt, excessive or insufficient sleep, poor concentration, restlessness or slowness, loss of energy, or recurrent suicidal thoughts. Psychiatric guidelines state that you can be diagnosed with depression if you exhibit at least 5 of the symptoms. And the symptoms go beyond behavioral ones. Inside the brain, depression manifests as physical symptoms. First, there are alterations that are visible to the unaided eye and with X-ray vision. Hippocampal volumes and smaller frontal lobes are a couple of these. On a smaller scale, depression is linked to a few factors, including abnormal serotonin, norepinephrine, and dopamine transmission or depletion, blunted circadian rhythms, or specific changes in the REM and slow-wave phases of sleep, and hormonal abnormalities, such as elevated cortisol and thyroid hormone dysregulation. But the exact reasons of depression remain a mystery to neuroscientists. We lack a diagnostic tool that can precisely forecast where or when it will manifest itself, despite the fact that it appears to be related to a complicated interaction between genes and environment. It can be difficult to tell who appears to be in good health but is actually battling with depression because its signs are invisible. The average person with a mental illness waits over 10 years before seeking care, according to the National Institute of Mental Health. But there are remedies that work incredibly well. In order to increase brain chemical levels, medication and treatment work best together. Electroconvulsive therapy, which simulates a controlled seizure in the patient's brain, can be extremely beneficial in extreme circumstances. Investigations are also being conducted on additional possible treatments, such as transcranial magnetic stimulation. So, if you know someone who is depressed, kindly suggest that they look into some of these possibilities. You might even volunteer to assist with specific chores, such as compiling a list of questions to ask a doctor or seeking out local therapists. These initial measures could appear impossible to someone who is depressed. If they experience guilt or shame, remind them that, like diabetes or asthma, depression is a medical disease. They shouldn't expect themselves to merely get over it any more than they could will themselves to get over a broken limb, because it's neither a weakness nor a personality attribute. Avoid comparing depression to other times you felt depressed if you haven't really experienced it. They may feel guilty for struggling if they contrast what they're going through with typical, transient emotions of grief. Even simply discussing depression in public can be beneficial. For instance, research demonstrates that inquiring about suicidal thoughts really lowers the suicidal risk of the subject. Open discussions about mental illness aid in reducing stigma and make it simpler for people to seek assistance. Additionally, as more individuals seek treatment, researchers will learn more about depression and develop more effective treatments.